Welcome all. Thank you so much for joining us for today's GGU Presents program. It is my sincere pleasure to welcome Michael Baisley, the Director of Communications for Golden Gate University. Michael.
Thank you, Priscilla, for that generous introduction. I appreciate it. Today, I think we're going to have a very good and topical discussion. We'll be talking about the role and the utility of big data and artificial intelligence for tracking and monitoring COVID, which is obviously in the news. Obviously, we're in the middle of a global pandemic right now, the likes of which we have not seen for more than a century. And being that this is both a medicine and a science event, data is connected in some form or another to every aspect of this almost, from the information gathering that exists to trying to track the pandemic outbreaks, to the testing that's being done to try to track and manage the outbreak. 62 million tests have been done to date worldwide, I think, as of yesterday. To the data science and the artificial intelligence that's already being deployed in the hunt for a vaccine. There's a lot to talk about today. But before we get into it, I want to let people know that you do have an opportunity to ask questions throughout the show. We'll be looking at those and trying to answer those as you go along. If on the lower right-hand part of your screen in the bottom bar there, you should see a Q&A link that you can click and go ahead and type in questions throughout the show as they come to you, and we'll be watching those and do the best that we can to try to get the answers to you. Really, really lucky to be joined today by Dr. Siamak Zadeh. He's a professor and data scientist at GGU here. He has over 30 years of academic and IT industry experience. He's worked in a variety of organizations such as IBM Research and Oracle. He's done research in the application of scientific techniques to many IT and business problems, and has participated in several industry focus groups and standard bodies, articulating the emerging needs for digital transformation. Welcome, Dr. Zadeh. It's great to have you.
Thank you, Michael.
So you recently published a paper on data and AI and COVID. So let's just jump in. What got you interested in that?
Well, I have always been interested in application of data analytics to a variety of business and socioeconomic problems issues. Healthcare industry has been one of the area that I had focused in the past from a variety of professional, positions that I had. But when the pandemic came, as I'm sure it's for a lot of other people, it was my first time, that I had experienced such a massive global spread of an infectious disease. And the question that actually came to my mind is that we've been there before in a smaller scale. What is out there that in terms of the access to the data and use of data, utility of data, and some of the advancement has been made in the field of data science to tracking, monitoring, and mitigating the risk of this infectious disease. To my surprise, despite the fact that significant advancement had been done, not much had been utilized. So I figured, okay, let me first gather all the information that I can from the global efforts in this area. And that became my review paper that I published in May about the role and utility of big data and AI for exactly what I mentioned, tracking and containing this pandemic.
This is really an unprecedented opportunity, isn't it, to look at the way, not only to use data in ways that can have a really significant effect worldwide, but to also examine new ways that we can do that and to look at how we can have an effect across the board here. Why don't you talk a little bit about, for people who aren't familiar with the term big data, even though it's been out for a long time, some people may not know what we're talking about. What do we mean when we say big data?
As you mentioned, big data, as the term has been basically coined for the past, I would say 2 decades or so. Its definition and its characteristic has evolved. But generally, when we refer to big data, we're talking about the type of data that has emerged as having large volume, has variety of data, and we talk about what that means, and the velocity. Generally, when people refer to big data, they refer to it as those 3 V's: volume, variety, and velocity. By volume, as most of your audience will know, the data is measured in terms of bytes. Right now, I think average user probably is more familiar with the concept of megabyte, and more so now recently with various devices that you have. You buy a smartphone, you ask how much storage you want, gigabytes. But these are very small comparing to what is emerging. Data is being collected, generated, aggregated at a rate we've never seen before. For audience who may not be used with the higher units of measurement of it, these days we're moving into the concept of terabytes, which is 3 orders of magnitude bigger than gigabytes, petabytes, and as well as exabytes. Those are probably not very commonly used terms for people, an average person on the street, but a lot of data architects and enterprises are planning having such a storage. Social media, particularly companies such as Google, Facebook, are dealing with exabyte of data that they have to collect, manage, manipulate, access, analyze for a variety of business reasons. So volume is one aspect of it that's growing very rapidly. The other aspect is variety. Data used to be generally presented as a simple tabular data, tables, rows and columns. Not every data now can be stored in such a format. We're moving into an era what we call unstructured data, images, videos, text, a variety of data format that is no longer deposited or stored or manipulated in a very tabular representation. So that increase in variety has also created needs, especially in healthcare. If you look at typical healthcare data, you have your typical medical records, your pharmaceutical records, images, if you've taken any x-rays, MRI, CAT scan, these days are all digital, all are different formats. So those cannot be simply stored. So big data has all of them in addition to the pace and the speed that's coming at us.
Right. And the scale of it is just massive when you stop to think about it. I mean, you think about all the visits that somebody makes to the doctor, multiply that by 300 plus million people in the United States, however many billions of people in the world. And like you say, the pharmaceutical data and everything like that. I mean, it gets big very, very quickly.
And add to it, what has happened in the past 20, 30 years, the mapping of human genome, and we're doing, genomic sequencing, genetic sequencing, especially when it comes to these type of new, strand of viruses. The very first attempt happened to identify the strand of virus is to do a genetic mapping of that strand of virus. And that's essential. And we're moving in an area that genomics and genetic sequencing is becoming part and parcel of medical coverage toward what we're calling a personalized medicine, to really create a care suited for your genetic predisposition. So data is just exploding, and the pace, the data is being collected, both from human generation data as well as sensor generated data, satellite generated data. There's not a shortage of data these days. So the question usually happens when we have a pandemic of this nature. What are we doing with all that data? Why are we not aggregating, condensing, summarizing them to enable to gain insight from that into containing and mitigating risk of this pandemic?
Well, and let's talk about that and go back to the very beginning of this when the virus was first identified in China. And immediately we're now talking about the application of some sort of data. We're talking about utilizing the collection of data that has existed worldwide to help identify this. Explain a little bit about what that process is like for, say, some of the international or national agencies.
This is not the first time that the global community has experienced an infectious disease or pandemic. Not to this scale in modern times. I think the last worldwide major pandemic is referred to as Spanish flu of 1918. Most of us were not alive that, and not so much, data analytics were done at the time, though some has been done since then. But this time around, when the infectious was first identified in December in the Wuhan province of China, immediately the center that was doing it, after some initial, I guess, resistance to call it a new strand rather than a variation of the flu epidemic, they identified this as a new coronavirus, a different strand of those SARS-2 type of, COVID SARS-2. And then once that happened, then the global infrastructure that has been in place for many years, both in the US, such as the Center for Disease Control and Prevention, CDC, as well as the World Health Organization, WHO, had put in place for collection of infectious diseases. In the US, that was more of a recent one, but the WHO organization had put what's called FluNet, an infrastructure for collecting, aggregating, sharing of information and data regarding infectious diseases globally. So as it happens, anytime there's an infectious disease, every county health department collects that data from care providers, whether it's a primary physician or clinics or hospital, provide that data to CDC or regional, and that data gets aggregated to FluNet. Based on this, had we had moved quicker on the initial phase when that became identified as a new pandemic in early January, we could have possibly have looked at it in a different light and had a different policy to contain and mitigate it had we moved forward. But there was a disarray of that type of data sharing, and that's still persistent within the healthcare infrastructure.
So talk about that for a second. So FluNet exists to help track flu outbreaks around the world. And then the CDC has its own process.
I'm sorry, could you move closer to the mic? I couldn't hear the question.
Yeah, sure. No, I said FluNet exists as a way to collect data on flu outbreaks around the world. And then the CDC has its own process. But this isn't a flu. This is something else different. What was the process for identifying it? And did FluNet play any role in that?
Well, generally, the process for identify any type of new infectious disease is first identification of the pathogen. And that's where basically now with the modern technology and genetic sequencing, you can really identify the strand of the virus. And doing that, you can actually identify, because initially, if you recall, a lot of people when had initially exhibited the symptoms of this disease, it's a very flu-like. So they were dismissed as, kind of a very flu-like disease, or possibly, leading to pneumonia. And they were basically sent home rather than tests to be done to identify that. But once it became that this is different, as the initial death rates due to this new disease started going higher, the data started getting collected, and after identification of the pathogen, then the next question is that understanding the transmission dynamics. That's where all the data collection becomes important. Not only you know what the virus strand is, and if you have a good model of sense of the transmission dynamics, and then you can start mapping and creating models to look at some possible scenarios for how this could spread in different communities, and then adopt policies based on that. So one of the early policy, as we all know, was social distancing, based on the information that had been gathered, based on knowing about the spread dynamics of this, transmission dynamics of this pandemic, try to mitigate that. But because of the lack of uniformity of the application and rollout of such policies, we are here where we are. The countries or regions where they actually, from the very beginning, leverage the data collection, data analysis, and prediction, did a better job of mitigating and bringing down the spread rate as well as the death rate down. And now, unfortunately, we're experiencing the second surge, second wave of this pandemic, and we're going back and forth between reopening, changing a policy, wearing masks, not wearing masks, all that. So data and analytics can help by collecting and analyzing, provide various scenarios to reduce the rate of spread and mitigate the risk to broader population.
So what happens here is somebody falls ill and they contact their doctor, and the doctor makes whatever assessment they think is appropriate. And they may or may not identify that person as somebody who has the coronavirus. But let's say that they do identify that person. That information is then reported up to the local health officials, county health officials. I believe that's a requirement in the United States or some areas of the United States. And then where does the information go from there? And is that where things have broken down?
Well, if I heard you correctly, since your audio is coming a little bit choppy, if I heard you correctly, the question is that with all the data collection, where we are and where we are heading, and what are some of the challenges we face with that. So part of the reason I think when I did my paper is that in addition to needing an infrastructure to collect appropriate data, and some of them could be health related data to a variety of people who have been infected that had to be protected. So we have to make sure that whenever we are sharing, exchanging healthcare data, not only meet the regulations that this country has, but also make sure we use it in an anonymized form such that the personal information is protected, but at the same time, we can use that information, such as, for instance, contact tracing and other activities of that nature, to identify areas that there's a cluster of such activities with higher probability of basically the transmission. And then try to, basically put policies to reduce that. And once that happens, then we can basically try to bring that whole, what we call flattening curve, bring the increase in the spread of rate of transmission. Right now, in some places in the US, we're seeing an increase in daily rate. And that is very concerning. So we definitely need to kind of monitor these on a regional basis on areas that these clusters of spread is happening, reduce down the activities that are causing, possibly leading to it. And then once this is managed and contained, ultimately bring down. The long-term probably solution for this would be from the medical establishment field and pharmaceutical industry to do through variety of research and development, identify the right vaccine for this pandemic. That's probably more of a longer term solution. That is also a very data-driven activities. Every clinical analysis of any new vaccine or new drug goes through a series of data-driven studies to make sure not only study the efficacy of such new drug or vaccines, but also that it does no harm. One of the first rule of medicine is that it does no harm. So you don't want to really come too early into market with a vaccine or some medications that are harmful to the general population. Thank you.
Okay, so the question that I wanted to get at, you mentioned in your paper something called a health internet. What exactly did you mean by that, or do you mean by that?
Well, the health internet has been a term coined by the healthcare specialists, data scientists, and all the stakeholders in these community to create an infrastructure for health-related data collection, aggregation, exchange toward the improvement of the healthcare delivery across the board, not necessarily for infectious diseases. But in this case, it's very essential for mitigation and containment and tracking and monitoring of this pandemic. Right now, healthcare data in the US is all over places. It's very siloed. It's not interchangeable. Your primary doctor keeps your records. The clinics that you may have been referred to for some special care keeps a different records. The hospitals and institutions have a different electronic healthcare system. And because we have multiple stakeholders and care providers, there's not as federated and aggregated data repository, then all that such information can be easily interchanged, exchanged for better care delivery, or this time for monitoring and contact tracing, all that too. Because not everyone uses exactly the same electronic health record, and significant portion of the health records in the US are still paper-based. We have moved toward electronic health record for the past 10, 15 years, but hasn't really created a very unified. Now, some countries who have a national health system like the UK, NHS, they have put in place an infrastructure for that. And recently, in fact, a group of scientists at Oxford University studied the records of 17 million patients that have been impacted by the pandemic to identify exactly the various symptoms, the incubation period, how they recover from it, those who have not recovered it, what were the general predispositions of those patients and all that. This is very beneficial, for that. We don't really have such an infrastructure in the US yet.
Right. So presumably that is going to give them a leg up on finding ways to mitigate this if it already hasn't. And I know that I believe it's Oxford that is sort of out in front in some areas on vaccine development too.
Correct.
I wonder how much of that is due to the fact that they have this sort of massive corpus of information that they can tap into. But I guess we'll have to see. When we talk about the government control of data, there's been some interesting developments during this pandemic. I know that, or I was reading that in, I think it's China, they had developed something called a health barcode, and they combined things such as a person's health status, which they reported, their travel history, aviation, railway, ground transportation, GPS stuff, and they would pull all this information together and create a risk assessment for that person. And then they would contact them and give them certain restrictions on their behavior. In Taiwan, they've got a universal health insurance database. They combine it with immigrations and custom databases. They're getting real-time alerts, or they were when people were moving about and stuff. So the centralized information is really potentially really powerful. Also, maybe some privacy trade-offs there as well, right?
And I guess you just, exactly stated the trade-off between the benefit of such a wide data collection of individual health conditions and positions, all that, versus their privacy. I think the way to deal with that is to have regulations that would protect individuals against abuse of such data. For instance, denial of healthcare insurance to individuals who may have some predispositions to these or have other conditions, all that, for the good of the society, for the collective good. Because this way, especially when a pandemic of this scale, we have to deal with, we need that level of information for better monitoring, tracking, prevention, and containment. So there's balance between, and Europeans seems to have a better regulation in terms of data privacy. And so that's the thing. Technology, there's significant advancement in capabilities to anonymize data. So if you are trying to collect data for tracking, monitoring, containment, you can easily use such technology. So you're not really inadvertently violating privacy rights of individuals when data is being collected. Right now, I think it's just building a trust in public that such data can be collected, anonymized, and not used against them is very important. So we really need to all work together to make sure the right regulations in place, right protection in place to avoid abuse of such data collection.
Yeah, I don't know that we're ready for that in the United States yet. And I only say that because I've read about some of the contact tracing efforts that have been underway and the reluctance of some people to either pick up the phone when they've been contacted to find out whether or not they were in the vicinity of somebody who was ill, or just a resistance to answer questions in the first place. So it seems like, that's going to vary from society to society, but it seems like in a country as big as the United States and with sort of this rugged individual.
Definitely. But one
No.
thing about this pandemic, this is very global.
Right.
We all are an interconnected community, and it's very essential for data sharing. Like one of my concerns is that our lack of participation or non-participation in the World Health Organization is very essential that we keep that channel of data exchange, data sharing with the rest of the world, because this type of pandemics is not going to be localized to one region anymore.
Yeah, talk about why that's so important, because our current administration has talked about has aggressively talked about pulling out of the World Health Organization and defunding it. And so where would that leave the United States, and also what effect would that have on the rest of the world? Because there's an interrelated sharing of information there.
Exactly. I mean, pandemics of this nature, it's not limited to one region. And this one, he probably is the most global that I have experienced in my personal life, and most of us have experienced our personal lives. So for that reason, we need to keep our data sharing and data exchange and information sharing as full pace and full speed. Otherwise, isolation will, basically cause not having enough information in terms of the advancement may happen in one region, let's say Europe versus US, or China for that matter, or even large countries such as India, or these days Brazil, which seems to have a very high rate of spread and mortality rate. So we need to have access to information. This is a global community. And now there may be flaws in some operations, both at CDC or WHO organization. So our efforts should be in helping them to correct those flaws, rectify what they may be doing that may not be yielding appropriate results. But total withdrawal and total, pause of exchange of data information, it's more harmful to our society and the world than benefit.
Well, and how do we also live in a very politically dynamic world. How do we prevent data from being used as a political weapon?
Well, that's a very good question. Again, that goes back again and to the concept of regulations. Regulations not only at the local, regional, national, but also international. And that's why we have organizations like the UN, as we have reached out a global treaties on, let's say, IP, intellectual property. We can do the same thing for data privacy. We need to make sure that there no abusive data will lead to lack of collaboration, cooperation, and use of information for the benefit of everyone. So that's where we need balance between that. And it's still a long way to go that. I agree with that. It's not something we can do overnight, but we have to aspire toward such in that, because we can no longer live in a not data-driven society. Every aspect of our life now is data-driven. The other day I was looking at BART, the Bay Area Rapid Transit. They just put a new announcement that a data-driven crowd charts for their passengers, so the passengers can look at the ridership of a different time of the day, different routes, to see where the high density of passengers are, so you can adjust your schedule. So even a simple organization like BART, it's a data-driven operation. This is just a very small data ridership.
No, that's fascinating, and as a way for people to adapt their behavior. Is that something you find on a cell phone, or how do you access that information?
That information is available. You can actually put a BART application on your smartphone. It is on their website. It's called Crowd Charts, and they have those charts for every route for a period of time and for different time of the day. And it's color coded. It's a very simple application of descriptive data analysis to the ridership, so people can view and make decisions that which are the times best for me to go commute. There are still a number of people who need to commute to work.
Right.
And if they have to rely on public transportation such as BART or buses, I have not seen whether Muni has done that or not, but that would be something that people need to do. We need to look at data to make decisions about our lives, about our community, about our society, and about our global activities, interaction. So you cannot really separate data from any aspect of our socioeconomic activities.
Well, so the BART example is really fascinating because the applications of that, so that's something that came out of this whole health crisis that we're in, so that people can see whether or not
Exactly.
they're going to be comfortable on a crowded train or not. But that is something that will have applications going forward as to whether or not you want to be on a crowded train, period, on your way into work. I mean, I would have loved to have had something like that 6 months ago, even pre-pandemic. Just so it's interesting, some of the innovations that can come out of this data.
Well, that
collection.
should be our hope, that we, out of this pandemic, we move toward establishing a wide infrastructure for collections of health data related particularly to infectious diseases that allows us to move quickly, identify a pathogen, identify the transmission dynamic, and make prevention the norm rather reaction to dealing with that infectious disease. And that's which hopefully should be something that COVID-19 should teach us and help us aspire towards.
So the other half of the title of your paper talks about AI, artificial intelligence. We haven't really talked about that, but there's a lot of work already being done in that area as part of this pandemic, and I think some of it is related to helping find a vaccine, hopefully at some point. Can you talk about the role of AI when we're talking about medicine and health data and so on?
Well, as I did with the big data, let me first give a basic definition of AI, because the definition and concept of artificial intelligence has evolved throughout the past 40, 50 years. The term artificial intelligence was coined in the 50s, and most scientists give credit to a gentleman named John McCarthy, who convened a workshop and event for people to look at a variety of activities that early computers could do to mimic certain intelligence behavior of human being. So that was the initial identity, that things that could mimic how we make a decision, the process and aspects of decision making, so-called intelligence. That definition has evolved significantly. AI has become a big umbrella for a lot of activities, including the concept of machine learning, which is more of automation of some of the statistical analysis and predictive model we do, with deep learning, neural networks, automatic voice recognition, some image processing, natural language processing. So it's much broader, field now than it was 50 years ago. But the whole idea here is that from analysis of data, we can learn certain patterns to be able to make some predictions and keep revising our model or so-called algorithms so our predictions are better, more accurate, and less erroneous. So that's what it is. And so healthcare is a very suitable field for that. First of all, you're never going to have enough human capital to apply to every aspect of healthcare. So automation of some of those processes is very natural doing that. It's been looked at, in the past 20, 30 years in variety field, in identifying certain patterns of, people in terms of infectious disease, the spread disease algorithms, distribution of information regarding that. And in the past many years, scientists have been studying that, how this could mitigate some of the risk of infectious disease. So in this area, with all the data we have, if we could collect the data in terms of the probabilities that would lead to being infected, we could actually start collecting data and keep making those modeling predictions and base our policies, our activities based on modeling. Some of those activities for the COVID-19 on earlier stages, already there's been some promising results that have been published that. But in the past, like for instance, for prediction of flu seasons, for prediction of other infectious disease, they have been doing significant modeling through the concept of machine building or predictive analysis. Yeah. One of the benefits of data analysis is that you're not limited to the early phase of it, which is definitely referred to as descriptive analysis. You learn from that to do diagnostic analysis and then predictive modeling. And that's where really the value of AI could come.
So you're not a doctor and you're not a health researcher, so I don't expect you to have the perfect answer to this. But do you think that the use of artificial intelligence and how that's applied to data will result in possibly a quicker vaccine than maybe what we would have been expected in some other context?
Well, definitely data analytics and artificial intelligence will complement and supplement human endeavors in this area and human activities. It's not a replacement. So a lot of people think that this is general replacement. But in terms of the various scenario modeling, various simulations, definitely. You could automate the process of your predictive analysis and come to a better selection of the options that you have for either for vaccine development or new drug development or anything else in healthcare. That is a plus. That's a significant advancement. Right now, I have in my paper a few examples of how AI has been helping healthcare, whether it is in monitoring generally, especially for chronic disease, because one of the things that this pandemic has basically demonstrated is that people who are suffering from some of the chronic diseases like diabetes are more vulnerable to this pandemic. They may have higher mortality rate and probability. So by monitoring these things here, by monitoring people's health, especially if you're suffering from these chronic diseases, and automate that collection of that information, you know, right now there is an increase in a number of wearables. Most of those wearables people use for generally what's called wellness,
right,
not health, like exercise, fitness. But same technology, same concept can be used for monitoring the health of chronic, disease patients. And then if they are more vulnerable, they reach a stage that the probability of post-infection or adverse reaction to this pandemic becomes worse, you could possibly interject and do more prevention. So you could use it there. It's been used in the clinical phase. It's used for the treatment phase, long-term care, post, operation, monitoring of patients. So automation and telemedicine and AI will have a significant role in improved care that we're going to receive in the future.
I can't remember if it was Hong Kong or South Korea, but one of them deployed tens of thousands of wristbands that would collect information such as fevers and stuff like that to try to identify when there were going to be outbreaks. There were some researchers, I think, at NYU that had identified, what they wanted to do was to help hospitals predict which patients were most likely to have really bad side effects or consequences for having COVID, so that they could figure out what the demand was going to be on the various facilities and the equipment needs, stuff like that. And so they identified some biomarkers and I think they had looked at what had happened in Wuhan and taken some of that information and figured out which patients might get the sickest. And then they applied some machine learning algorithms, and they trained the model to determine patterns, and they could forecast the severity. And then they entered them into a model, and they came up with some sort of numerical score ranging from 0 to 100. So it's what's fascinating to me is the number of scientists across all the disciplines that are working on this from so many different angles. I mean, this must be a fascinating time to be a data scientist and somebody who follows this area, this discipline and this field, to watch all of these people sort of attacking this problem all at the same time.
Absolutely. And this is, is as data driven as you can ever imagine such a large public and global issue is in this pandemic. So it is definitely requires all, medical professionals, all, basically healthcare professionals, data scientists to work in tandem, collaborate, and learn a lot more about this infectious disease, bring it under control, mitigate the risk to, for future, as well as hopefully develop a vaccine, all that. So this is something that probably for data scientists, and it's a case that there's so much data is being now generated for that you can look, as you mentioned, for patterns, trends, and update the variety of algorithms and models that you have. And that's the thing about data analysis. You never get fixated on a single algorithm model. You're continuously revising, updating by training your model with the new data that becomes available.
So I want to talk about a little bit about how sometimes it misses the mark. But first, I want to remind people that if you have any questions that you want to us to try to answer, go ahead and hit the Q&A button down there, and we'll get to them. There was a situation, and we talked about this before the show started, about information gathering. There were researchers at the University of Washington who had collected a bunch of data and different variables, and they put them into a database, and they created predictions for various geographic areas of the country for when they thought the pandemic would peak and when it would crest and we would start to flatten the curve. And they looked at things such as the different types of social distancing things and different requirements that different geographic areas were putting into place. And they looked at the different demands on the healthcare system. And this became actually widely cited throughout the country, the work of these researchers in the media, by government officials. They didn't always hit the mark, and in fact they missed the mark sometimes in their predictions, pretty significantly in some cases. I know in the Bay Area they had predicted that I think that things would peak here in early April, and that is not what happened. The problem with that is then we have a question of sort of public trust now in data. And an opportunity here for that to begin to erode. What do you think? Talk about what happened there and why data is not perfect and the outcomes of data is not always perfect.
And that brings us to the concept of the limitations of data analytics, even AI, or some of the existing algorithm models we have for prediction and forecasting. That study particularly would happen at the very earliest stage. My sense is that may have been some of those models that created were not well trained. So some of the conclusions reached probably were premature. But overall, entire scientific efforts, and data science is not exception of scientific efforts, is that it is an iterative process. You start with some basic observations, come out with some hypothesis, collect data against your hypothesis, make observations, either adjust, validate, correct, revise it. This is going to be an ongoing process. Now reach the point that enough data is collected that the models should be better for some of the, it's still working?
Yeah, you're cutting out there just a little bit. It sometimes happens with Zoom.
Okay, just want to
yeah, but I think I can
make sure that the audio is coming through. Anyway, so
just a little bit of the hiccups as the data transmits itself across the internet, right?
Okay, so it basically is that now enough data has been collected to go update such models and add the new data has been collected, especially the new data coming from the second wave that we are seeing in parts of the country, to train better the models they are, revise the algorithm models to have a better understanding of the transmission dynamics and spread of this pandemic disease. So data analysis has limitations just like any other. Even sometimes in medicine, some of the early diagnostics by physicians may not be accurate diagnostics. And they collect more data, they go through some more clinical research and study and come back to that too. That happens. This is not uncommon for early research in an area.
We've talked about a lot today. One other thing that I want to talk about a little bit is, and related to that, is the imperfection of it. There is a human element to this. We're collecting health information. We're collecting information from human beings. And we're also, in this case, trying to combat a virus which is doing its own thing and sometimes mutating, and it's unpredictable. We've never seen this particular virus before. So we're never going to get to the point where the data analytics, the analysis of the data that we have, predicts perfectly and beautifully in the way that we want it to, right? I mean, we need to sort of calibrate our expectations here.
Data analytics, or even AI for that matter, are not panacea for all our healthcare needs, particularly in regards to such a large scale pandemic. So, but at the same time, it's a significant, activity to supplement and complement our human efforts. So that's why they need to be basically monitored, checked, and with the number of the scientists that are looking at this infectious disease, including both the medical profession as well as data scientists, I have confidence that eventually right predictive modeling will emerge out of all these various scenarios, all that too. So, and that's why this open concept of, reviewing and monitoring all these various data analysis is important, knowing that there are also limitations to all such efforts. And that's why it's, look at the probability of and accuracy of these analyses when it comes to making any major decisions, health related or social policy related.
So I guess the optimist point of view would be that we're learning a lot. We're 6 months into this right now. We are learning a lot about what we know and what we don't know, and what we still need to do to sort of perfect this. I would imagine that we're building a good foundation for when, God forbid, we find ourselves in another situation like this. So if there's a silver lining here, it must be that we've learned so much about what we can do to try to apply our human endeavors to something like this.
I agree, absolutely. It is a learning process, and just like any other, past crisis, we have no alternative but to collect data, make observation, learn from it in order to prevent future crises of the same. We cannot allow this to happen again at this magnitude and be unprepared to monitor, track, mitigate, and contain it.
Well, great. This has been, to me anyway, a fascinating discussion. I appreciate you taking the time to join us today.
My pleasure.
So for folks who want to follow up with this later or tell their friends about what they missed, if you go to our GGU Presents page on our website, you'll be able to see, there'll be a recording of this up and about hopefully within the next week or so, and you can go back and watch that. And we're going to have, we're trying to put new stuff up every week on our GGU Presents platform. So I believe we have something coming up next week and the week after that. So go to the page, check it out. Thank you again so much for your time. Thanks for the folks who joined us today. And Priscilla, over to you.
Thank you so much, Michael. Thank you so much, Michael, for leading such a wonderful discussion. I learned so much from today's program, from Michael's really inquisitive questions. And Sia, you are a wealth of knowledge. We are so lucky to have such a talented individual as part of our staff.
Couldn't agree more.
My pleasure. Thanks to be here. Thank you, Michael. Thank you, Priscilla.
All right. Goodbye, everybody.
Thank you. Thank you for joining us. Bye.